Good afternoon, everyone. We are all aware that the number of positive cases of COVID-19 continues to grow throughout our community. Our neighboring county, Lehigh, has moved from moderate level of community transmission to substantial level this week. Currently, Northampton County and Monroe County are in a moderate level of community transmission, while Pike County remains a low level. It is reasonable to project that Northampton County will move from a moderate level to a substantial level in the near future, maybe even next week. Over the past several weeks, RIU has engaged in conversations with the Department of Education, Department of Health, medical professionals, and school leaders in our region, as well as our neighboring regions, to discuss the process that occurs when a county moves to a substantial level of community transmission. First, if a county moves to the substantial level, the Department of Education and Department of Health will engage in a conversation with myself, superintendents in that county, as well as other school leaders from technical schools and charter schools. This meeting is conducted to share information regarding the level of community transmission related to COVID, how COVID-19 is impacting the school's health and safety practices, the current instructional model, guidance, and recommendations moving forward. Prior to shifting from an in-person and/or blended model of instruction to full remote learning, the Department of Ed and Department of Health continue to offer guidance that schools should consider shifting after 2 consecutive weeks at the substantial level of community transmission. Therefore, I wanted to be clear that if the county moves to substantial level, this does not mean that our schools will shift from in-person and/or blended models of instruction to full remote instruction immediately. Furthermore, in my conversation with other educational leaders across the state, many of our school districts have continued to provide in-person and blended models of instruction, even when the county has been in the substantial level for consecutive weeks. One might ask, why is this occurring? First, medical and health professionals continue to research the transmission of COVID-19 in schools and are continually learning more about the virus. Therefore, information and guidance continues to evolve regarding how schools are keeping our students and staff safe and healthy within the school environment. For example, nearly all countries in the second wave of COVID-19 have maintained a level of in-person instruction, as they were finding no consistent pattern between school status and infection levels. Secondly, we are finding that students and staff are not contracting COVID-19 in school. People are contracting COVID-19 in the community. This is having an impact on our students and staff. Therefore, everyone is well aware that schools are notifying everyone of a confirmed case of COVID-19, and those notifications have increased. In some situations, we are quarantining particular staff and students that have come in close contact while schools remain open for in-person instruction. In addition, we have had situations in which a particular classroom and/or school has closed for in-person instruction for a period of time. Yet, in coordination with the Department of Health and medical professionals, schools seem to be managing these situations to keep in-person instruction moving forward. In fact, since the start of the 2020-21 school year, CIU 20 has only had 6 positive cases. None of these cases were contracted in the school setting. I firmly believe that the main reason we've been able to keep COVID-19 positive cases low in our schools and remain open for in-person instruction is due to the exceptional health and safety practices by our staff, students, and families. By continuing to stay vigilant and engaging in practices such as masking, social distance, symptom monitoring, proper hygiene, cleaning, and disinfecting has made an enormous impact in keeping the transmission of COVID-19 out of our schools. Furthermore, allowing our students and families to have an array of instructional models, such as full remote learning and blended instruction, has allowed our schools to balance the number of students in a school building on a given day. All these practices make a difference. As we move forward into the next few months, we need to continue to be vigilant in these practices, both in the school and the community. COVID fatigue is real and very strong. We are all sick of COVID. We are all tired and exhausted from following the health and safety practices day to day. And in those situations, that collective fatigue is making people careless. This is in part leading to the rise of positive COVID-19 cases in the United States. We need to remain strong. In addition, I attended a meeting with several health experts from St. Luke's University Health Network 2 weeks ago. The doctors have made local school leaders aware that the perfect storm is brewing in November and December. COVID fatigue is occurring. Cases are increasing in our community. We are moving more activities indoor. Our college students are returning home during the holidays, and colleges and universities have been a source of increased positive COVID-19 cases. Also, holiday gatherings and travel will increase during the months of November and December, and the flu season is upon us. I would ask you all to please join me and continue to stay strong. Let's help one another stay the course and be vigilant in following the health and safety practices that have allowed us to keep our schools open for in-person instruction and have allowed our children to engage in activities in and outside of the school. Continue masking, social distancing, symptom monitoring, proper hygiene, and cleaning and disinfecting. Resist COVID fatigue. If possible, limit your travel and trips. Get your flu shot. Spread the word and remind your friends and families to engage in these practices. Most important, take care of yourself daily. Try to eat a healthy diet, get plenty of sleep and regular exercise, practice mindfulness, and enjoy that time with your family and friends. We will continue to closely monitor COVID-19 positive cases in our community and continue to work with the Department of Health, local medical and health experts, and our school districts in seeking guidance and recommendations regarding the best practices to ensure the health and safety of our school community. Every case that we are made aware of, we will continue to partner with the Department of Health for guidance, notify our families, notify our staff, notify our local education agency, ensure cleaning and disinfecting of the work area and classroom is completed, and continue to monitor for any change in the type of work and/or instruction model that we are in at that time. We are all in this together, and we will get through this together. Remain patient, stay strong, and continue to engage in the actions to keep our schools and communities safe. Thank you to everyone. Your positive attitude, work ethic, motivation, and sacrifice will continue to lead us forward to brighter days.